You eat well, exercise, take care of yourself, but you still have stubborn pockets of fat.
I worked out, I did my best to eat as well as possible. I just got tired of trying the same thing and getting no results.
I changed my eating, going to the gym, working out.
No matter how many squats, jumps, you name it I could do, I could never find that happy medium.
Thank you for joining us this evening for our virtual event, Coolsculpting 101. What is it and does it really work? We are excited to share our years of experience with the gold standard in non-surgical fat reduction, Coolsculpting Elite. After our video presentation, please remain online with us to participate in our live Q&A. You will have a chance to submit your questions in the questions box in your screen, and we'll try to answer as many of those as possible. Don't forget, you've been entered in our drawing for a free Coolsculpting treatment worth $3,200, and there's many other prizes as well. All attendees will be eligible to receive $400 off and discounted package pricing for consultations booked in the month of April, which is Cool Month. Returning Coolsculpting patients can also receive a 20% discount on soft-wave treatments. Now let's get started.
I'm Dr. Matt Novak, a board-certified plastic surgeon here at Southlake Plastic Surgery and Med Spa. Coolsculpting is a non-invasive body contouring procedure. It is cryolipolysis, which means that cold temperatures are used to selectively target the fat cells and cause the fat cells to lyse. And then your body's lymphatic system takes those fat cells up and recycles them in your body. And so it's a way that from applying applicators, we can apply cold temperatures directly to the fat cells. It doesn't injure the skin, so there's minimal downtime, minimal discomfort associated with the procedure, and it's a great way to target stubborn areas of your body that have some fullness or contour issues that otherwise you might not be able to get at the gym or with diet and exercise. Coolsculpting is unique in that it is a non-invasive treatment as opposed to many other fat reduction methods. The most invasive of which being direct excision or cutting out fat, then liposuction. Both are excellent options for the right patient, but they are invasive procedures that require significant downtime. One great thing about Coolsculpting is there's very minimal downtime, minimal discomfort, minimal postoperative swelling. Patients can go back to work same day or next day. And then there's also other devices that are a little bit more minimally invasive, but also have downtime. So that's really truly one of the great things about Coolsculpting compared to some of the other minimally invasive or invasive procedures is that Coolsculpting has virtually zero downtime and it is non-invasive. Coolsculpting is a minimally invasive FDA cleared treatment for areas of pinchable fat of the inner and outer thighs, also the back of the thighs, or otherwise called the banana roll, just below the buttock. It's a great area of treatment and FDA cleared for the abdomen as well, the upper arms, as well as the submentum, or the area just below the chin. For patients interested in undergoing Coolsculpting treatments, the number of sessions that patients need is on average about 2 sessions, and that's because each session with the fat cells that are targeted, about 50% of those fat cells are removed from the body. And so adding on additional sessions is really beneficial to help us improve the results and achieve a contour that is really meeting your expectations. Excellent patients for Coolsculpting are patients who have very discrete but stubborn areas of fullness or fat in any one of those FDA cleared areas, and they are looking to improve the contour there and have been having trouble getting a better contour with just diet, exercise. And it's also a great option for patients who have lost significant weight but still have areas that are bothersome to them, particularly patients who may be using some of the GLP-1 drugs, patients who have lost weight with diet and exercise, or oftentimes patients who are in great shape already and are just looking to kind of make some kind of additional tweaks to improve their physique and contour. And most importantly, you know, areas that are great to be treated are areas that are pinchable fat. And so that can be any one of those FDA treated areas of the thighs, both inner and outer, the back of the thighs, the abdomen, the upper arms, or the submentum, or an area underneath the chin. The downtime associated with Coolsculpting, and in particular the Coolsculpting Elite, is minimal to none. The procedure itself, there's a little bit of discomfort as the applicators get the area of fat that's being treated down to the appropriate temperature. But otherwise, once it's numb and once that area of the body gets down to the appropriate temperature, there's really no discomfort. And then after the procedure, occasionally we'll have patients that tell us they have a little bit of tenderness in the areas that were treated. Almost always just well-tolerated tenderness. In rare cases, we'll have patients that will take Tylenol or ibuprofen for some of the discomfort. And then in even more rare cases, occasionally patients have reported bruising. However, we seldom see that in our practice.
Hi, Jen. How are you doing today?
I'm doing good. Thank you for asking.
Well, welcome to our med spa and for coming in for your Coolsculpting consult. Tell me what brings you in today.
Sonia, I have been on a GLP-1 weight loss journey for about 2.5 years. I've lost total about 45 pounds, but I still have this stubborn area right here in the upper stomach that's bothering me. I have changed my diet, I exercise routinely, and I just can't get rid of it. I really don't want to do surgery, so I want to see what non-surgical options I have.
Well, it sounds like you're on the right track. We'll assess you, but you probably would be a great candidate, being that if you had those stubborn pockets of fat. So let's see if we can assess you and work on that and get you some good results. What questions might you have?
Is this going to be a one treatment and done? Am I going to see instant results?
It's multiple treatments, and it usually takes some time. So over a period of 2 months, over 2 months, going into 4 months or so, you usually can see some really good results.
Great, thank you.
Thank you for attending our virtual event this evening. All of our prize winners will be contacted via email and phone. Make sure to check your texts after our Q&A. When you reply back, you'll be contacted to book a Cool Sculpting consultation to take advantage of our promotions. Cool Month starts tomorrow, April 1st. Don't forget to log into Ally to claim your $400 Cool Sculpting offer towards treatment. Now please stay online for the next 15 to 20 minutes for our live Q&A with our providers.
Good evening. Thanks for joining us tonight, and we're going to start answering some of your questions for our Cool Sculpting webinar. We already have several questions uploaded, so we'll start with the first one. One of our patients asked, if changes in diet and exercise don't change, does the fat, I'm assuming she means the fat, does it come back in other areas of your body? Stephanie, would you like to handle this question?
Sure. So you can expect normal weight gain and weight loss just like you normally do now. Just in the areas that are treated, you're going to have less of it. So you can expect that the areas that are treated aren't going to gain weight as they originally have in the past. If it is an area that you typically have that weight fluctuation, you can expect to no longer see that. But the rest of the body is not going to have fat deposits or anything in that way, but it's going to you're still going to have the ability to gain and lose weight.
Thanks. Okay. And another question is, how many sessions are needed to see results? Sonia, would you like to answer that question for this patient?
Yes, Sarah, thank you. Actually, usually we want to see 2 or 3 treatments done. It honestly depends on how much you have there and your concerns, and to see what gives you the best results. There's always a chance 2 will be enough, but now we're seeing some people do 3 and we're seeing even better results. So I would say overall, once we do your consult, we can kind of tell you more about what if we suggest 2 or 3 treatment, or 2 or 3 or more treatments.
Okay, thanks. And another question is, how many areas can you get done in one session? Stephanie, would you like to address this?
So we can treat up to 2 areas at once because we have the Elite device, which has 2 arms, and as long as the tissue is not competing, we can place those applicators simultaneously. But in a session, we can do multiple areas. So if you have a full abdomen and we map it to where you're having about 8 applications, then we can see you all in one day.
Okay, great. And this question asks, is Coolsculpting better than liposuction? Dr. Novak, would you like to answer that question?
Sure. I guess to answer that, I guess it really depends what your definition of better is. I would say that it's not better. Neither liposuction or Coolsculpting is necessarily better. It's that they're different. And so, what liposuction allows us to do is, more generally speaking, remove fat cells from larger areas of the body. Oftentimes, liposuction is paired with some other surgical procedure like a tummy tuck or an arm lift or, breast procedures. And so in that sense, tummy tuck would be more commonly, liposuction would be more commonly used. Whereas, the great thing about Coolsculpting and what it is, the patient that it's better suited for is someone who's looking to treat very specifically targeted areas, or maybe has small stubborn areas of fullness that they're looking to have addressed. So, really it depends on what the patient's goals are, what their desires are. And that's really one of the great things about, having a consult here in our medical spas, that our providers, Stephanie and Sonia, are very well trained to know the difference when a patient would be a candidate for Coolsculpting, when a patient would be a candidate for liposuction. And then both Dr. Mason and I are always available if there are ever any questions or whether a patient it truly is a candidate for either procedure.
Thank you. And speaking of surgeries and other surgeries, this question is, if you had a hysterectomy with a small scar in November, which would be about 8 months ago, 6 months ago, how long do you suggest to wait until starting a treatment? Dr. Mason, can you address this question for us?
I don't think that there's any hard and fast rule, but if it's been 8 months and everything's healing well, I'm sure it will be fine to start now.
Great. When you talk about contraindications, does hernia repair surgery near the area of desired treatment rule it out? And Stephanie, would you like to address that?
Sure. So obviously, every patient's going to have specific conditions or things that we need to consider. So during consultation, there is a question where we'll ask if you've had a hernia repair. If you have a hernia, we do not treat over an active hernia without a release from your physician that it has been repaired. But after you've had the repair and you've had the necessary downtime, we can treat over it.
Okay, great. And is there an age limit? Can people in their 70s have this procedure? Sonia?
Absolutely. You can, there's no age limit, anywhere from, I would say, 20 if you needed it, to 70s. We've seen people in their 70s have it. And as long as you're in good health, there's really not major contraindications for it. And as long as we consult with you and you have the proper amount of, the right amount after we assess you of fat, and it's something that it's not going to be too much laxity, that type of thing, then absolutely we can treat you.
Thank you. And is there anything to do with the loose skin after you lose that fat?
So absolutely, obviously, we would always consider multiple options for skin tightening. We have topical creams. You can go see one of our surgeons for a consultation, but we also have a really wonderful device here called Southlake that we utilize for skin tightening and lifting. So that would just be another consultation, and we would let you know if you're a candidate for that.
Okay, great. Thanks. And another question is, does it work on the neck area? So I'm not sure if you mean the neck specifically or under the chin going into the neck. So Sonia, you want to address that?
It does work on the submentum. Excuse me. Sometimes you can actually treat it with one. Sometimes you might need two. But it works. I've seen very good results on the submentum. As far as the neck, we don't put it down on the neck area. But as far as right under the chin, it works very well under there.
Okay, great. And why would you not have Coolsculpting done on your neck? Dr. Mason, can you answer that for us?
Well, the front of the neck is usually where the biggest fat deposits are, and under the chin. The side of the neck, you have your carotid artery, major blood vessels, and nerves. So it's best not to treat directly over those vital structures.
Thank you. If there's loose skin in the abdominal area from pregnancies, does Coolsculpting help tighten that area, or should Coolsculpting be combined with something such as a skin tightening treatment? And I think, Stephanie, you alluded to that.
Mm-hmm. There is a small level of tightening with Coolsculpting. It is FDA cleared for skin tightening in the submentum area, but no other areas in the body has that clearance. However, obviously, with during treatment, we suggest lots of body massage in the area after it's been treated, as well as using firming cream. And then, yes, of course, Softwave is our lifting and tightening device that we would utilize after Coolsculpting to help to fix any unwanted laxity.
Thanks. And then how does Coolsculpting work on areas that have fat that is dimpled, like cottage cheese, for example, on the thighs? Will it work and look smooth after treatment? And Sonia, do you want to address that?
I'll address it, and then if one of the doctors has something to add, but I would say that I have seen it smooth out those areas to a point. But it kind of depends on if you're talking about cellulite or just that dimpling effect. So I've seen someone that has had the dimpling and it has helped smooth it out. Does it kind of smooth it all the way? I have not seen that, but it does help with, if you're doing the Coolsculpting, it does help smooth.
Dr. Novak, have you seen that in your fellowship using Coolsculpting to help with cellulite or dimpling?
Not specifically for that reason, but I agree with Sonia. I think you can see a benefit, if the dimpling is just being caused by the fullness, of that fat underneath the skin, you can see a benefit from Coolsculpting. I try not to promise any patients that it's going to improve, cellulite dimpling or, even dimpling of the skin. It's similar in that regard to liposuction. The truth of the matter is that cellulite is like one of the most difficult conditions to treat. And that's evidenced by how many different options there are to treat it. And as plastic surgeons, we've tried different types of injections to break down the bands that cause the dimple. There's different methods that you can try to release the dimple with an instrument. Surgeons try to release them with surgery. And so, all these things have been tried because there's no really one superior treatment that gives like really excellent results. So it could, I do think that we have seen some improvement, but really it's just cellulite and dimpling of the skin is a tough issue to correct.
Okay, thank you for that explanation. Excuse me. The next question is, what if you have diastasis recti? Can this still be done, and can it help the condition? Stephanie, can you address this for us?
Sure. Similar to a hernia with diastasis recti, we're not going to treat right over the area. We would assess you for that, and it would need to be repaired before doing any direct Coolsculpting over that area. Otherwise, we would treat around it.
Okay. And Dr. Mason, can you address this as well? What the best treatment would be if they were very concerned about this, and if it cannot be treated with Coolsculpting?
So a diastasis of the rectus muscles is really common after pregnancy. We see it all the time. The gold standard for that is to do a tummy tuck and the muscles repaired all the way from the rib cage where it starts to the pubic bone. And usually that's a permanent repair. Some people recommend exercises for that, but I haven't seen that work. Surgically repairing is really the only true way to get rid of the diastasis.
Okay, thank you. And then Sonia, how long do Coolsculpting results last?
I've seen results, or I've read about results and seen some results that last for years. They did some research on it, and they were talking 6 years to 9 years out that people still had that good results. The only thing I would say is that if you're gaining weight, losing weight, that type of thing, then you can gain in other areas. Doesn't mean those fat cells in the area that you treated too can't grow, because the fat cells that are left can grow. If you start gaining weight, eating more, you're not watching your weight and staying on a good diet. So that's,
Okay.
doctors may have something else to say, but that's what I would say.
I think there is a little bit of confusion about weight gain and Coolsculpting and liposuction for that matter. Can one of you doctors talk about what happens to fat cells once they're removed, whether it be by Coolsculpting, by freezing the fat, or by liposuction, surgically removing the fat? Because people have said to us, oh, it doesn't work. I lost weight in my stomach, but now I gained it all in my hips.
Go ahead.
Once the fat cells are removed, they don't come back. But that's not to say that any remaining fat cells don't continue to expand and contract. And so, if we decrease the amount of fat cells in one particular area with Coolsculpting or liposuction, they're not going to come back. But any fat cells in that area can still enlarge. And then certainly in other untreated areas, they can still enlarge. So, that's why it's important after a procedure like this, like with Coolsculpting or liposuction, that maintaining your weight and a healthy lifestyle with diet, exercise is important to maintain the results of the procedure.
Thank you. And just a reminder, you'll be receiving a text message, and please reply with the code word ELITE if you'd like to be contacted for a consultation. Remember, we don't charge for consultations. This is a good way to ask questions that you may not want to ask in public. And you can also find out about other options that may be more appropriate for your concerns. And then let's move on to our next question. Are the results for Coolsculpting permanent?
Well, kind of going back to the last statement, this is permanent fat elimination with Coolsculpting within that specific area. There will still be some fat just for a normal contour left in the area, but yes, it is permanent results of fat elimination.
Well, following up with that, where do the fat cells go once you freeze them?
Your fat cells will die off and your body will absorb them and remove them through your lymphatic system.
Okay, thank you. And then are there more sensitive areas when considering this procedure, such as the face or neck? And are there different recovery expectations for more sensitive areas?
Sensitivity comes and goes for each person. It's going to be completely different. But yes, I would say from being a provider here for years, the most sensitive area that gets treated is definitely going to be your submentum or the chin area. It is very close to your face. It has a lot of anxiety included with it because you cannot move, swallow, or speak. So that kind of enhances the pain receptor, I think, in that area. But for the most part, you feel a little bit of a suction or cramping for the first 2 to 4 minutes of the treatment. And once the cold sensation takes over, it just goes completely numb. So you don't actually feel a lot of pain throughout the treatment. When the treatment is over and the feeling and the normal temperature of your body starts to return, then you're going to have a little bit of feeling, but pain is not necessarily the word I would use.
Okay, thank you. And then we have a question about logging into Ally, because we do have an Ally reward available. I will explain that a little bit later, but for everyone who's interested, when you text us and let us know that you are interested or you have questions, just text us the word ELITE, and then we'll contact you and we can follow up with those kinds of questions. But we will be giving you exact instructions on how to log into Ally and claim your $400 reward. And we'll go into that a little bit later. We did have a question about paradoxical hyperplasia. And Dr. Mason, can you address that for us? Explain maybe what it is, because there has been some negative press about Coolsculpting in the past with one of the famous models.
Sure. There's a really, really rare, I guess, complication of Coolsculpting where the fat actually grows in the area instead of dissolving away. And it was most common with the older machines and the older applicators. And I've probably seen 3 cases in my career, people that were done elsewhere, but the fat in the area grows, and it's exactly the opposite of what you want it to do. We don't really know the mechanism. Some people think because those fat cells are starved of oxygen, it prompts them to release certain chemicals and grow more. We don't know. But if it does happen, we treat it with liposuction, and I have not had any of those patients that needed anything else. We just did a little bit of liposuction in the area and they were good to go.
Thank you so much. And again, that was with our older machine. We've not seen a single case, correct, Sonia and Stephanie, since we've gotten a new machine. Okay. And one of the positives of having your treatment here is that we do have 2 board certified plastic surgeons who can treat any complications that might happen, although we've not had to deal with that in the last, 10 years. I think we've only had one case in all of our years of, or all the treatments that we have done with Coolsculpting, which is pretty amazing. And Allergan took care of everything because we so clearly documented and photographed everything properly, which doesn't always happen at every facility. And let's see. Which brings us to the next question. Sonia, how long have you been offering Coolsculpting?
I would say, thinking back now, but I would say it's been about 8 years.
Yes.
8 years, yes. 8 years that we've been offering it. But now that we have the new Elite system, we're seeing even better results with it. You can do more than one treatment at a time, so it saves time for our patients. And then, you know, you might not have to come back another day if you only had so much time in the day to stay. But yes, we're seeing better results. The adapters tend to grab on and suction better. So it seems to be really helping with the results that we get with the Coolsculpting Elite.
Okay, thank you. And another question is, why is it better to have your Coolsculpting done at your facility than somewhere else? Stephanie, can you talk about that a little bit?
Sure. So obviously here at Southlake Plastic Surgery Med Spa, both Sonia and I and other providers, we've all been excessively trained at the Allergan Medical Institute for Coolsculpting. I'm a master Coolsculpting provider, and that just means I've done the highest level of education in their facility at AMI. But really also, we are just really thorough with our consultations. We're really honest with our patients. We would go over your entire treatment plan, really try to communicate and manage expectations. And at the end of every Coolsculpting consultation, I try to encourage all patients to weigh all options, have a surgical consult, and that way you can really just make the most educated decision for your specific case.
Perfect. Thank you. And how much does Coolsculpting actually cost? Are we talking about $500 or is it $5,000? Sonia, do you want to talk about this?
Sure. First thing I would say is coming in for a consult, of course, is the best way to find out exactly. We can tell you, once you've come in for the consult, we can tell you exactly what it's going to cost for the areas we are treating. But just for instance, if we're doing the submentum area, it can run anywhere from $1,800 to $1,600, something around there, depending on, it also depends on if you need one or two for each session that you have. But then it goes up to, varies from anywhere from like $3,000, $3,200, something like that. And then if you do multiple areas, might cost a little more.
A good range, you can just really think as low as 800 and then over 3,000. It just really depends on the area and how many treatment adapters we're going to be applying.
Thank you. And then what is the actual recovery time for Coolsculpting? I know everyone says there's no downtime, but I've had laser treatments where they say there's no downtime and there was definitely some downtime. Stephanie?
There truly is no downtime. You may have a little slight redness in the area. Some people will experience a little bit of swelling, but nothing unsightly. I've had no cases of bruising. I've only seen that in a training environment. So downtime is really not a thing unless you're just uncomfortable, and that would be treated with a Advil. But you're free to go and do anything that you would normally do. As anything we do in our office, we always tell you to protect your skin with sunscreen because you have had a lot of different type of energy applied to that area. But absolutely no downtime.
Great, thank you. And it looks like we have covered most of the questions. I'm looking through one more time. Can you think, Sonia and Stephanie, can you think of any other contraindications where absolutely they would not be able to have Coolsculpting done?
Pregnancy would be one. Breastfeeding would be one. There is not, I mean, of course, if you have some autoimmune systems, autoimmune issues, we would always want to check with the doctors and possibly check with your doctors, because we do want to be very careful here. So, and that's another thing we do in the consult, is just make sure we've covered everything. But for the most part, there's just not many contraindications. Of course, the hernia, as we talked about, depending on the area that it's in, that type of thing. Can you think of anything else, Stephanie?
Yeah, so we have to make sure that the area being treated, the skin is intact. We don't have any injury to the area, hernias. It also, sometimes we do take into consideration if you have a large tattoo that covers the entire area that you're going to be treated. That is sometimes something we have to be a little bit more creative about our applicator application. We don't want the entire area underneath the applicator to be covered in tattoo. So that's another thing we have to think about. But there are specific conditions that you may have that make individuals very susceptible or sensitive to cold. And so we would go over all that in your consultation. And if you have one of those conditions, then we would not proceed. And if you are suffering from any other type of chronic illness, we would require a medical release.
Okay, thank you. And then this patient has asked, there are similar services to tone and tighten loose skin. Do you all feel that this one, Coolsculpting Elite, is the best on the market? And I'm going to ask Dr. Mason to address this, since he's been around probably the longest and has seen a lot of devices on the market and asked to buy several of these.
Well, I would say Coolsculpting is probably the best at fat reduction. You shouldn't do Coolsculpting just because you want to tighten your skin. There are other modalities for that, like soft wave. But I think it is the best tool out there for fat reduction if you don't want to have surgery. If you want skin, what? Sorry?
I'm sorry, how does it differ from some of the other fat reduction devices on the market today? For example, RF.
Right. Some of the fat reduction devices use radio frequency, some use heat. But it's difficult because you don't want to burn the skin to get the heat deep into the fat. So it's kind of tricky. And most of the time, the fat's not heated enough to make a big difference. At least with Coolsculpting, we're using cold. So it's safe on the skin. And, fat cells don't like it.
No, thank you. Okay. And Dr. Novak, is there anything you wanted to add?
I mean, I think we've covered everything pretty comprehensively, but I mean, I think the take-home point is that it's a great minimally invasive treatment, minimal downtime, if you've got kind of stubborn areas that you're looking to reduce the fullness in.
Perfect. Thank you so much. Well, thank you very much for everyone who's joined us this evening. Cool Month starts tomorrow, so don't forget, attendees new to Coolsculpting will have the opportunity to buy a $400 Ally promo on their Ally account, and you will need to go sign up for Ally if you don't have that. Again, we'll send out the directions for that step by step. If you have problems, we're going to be around tomorrow to answer any questions. Returning Coolsculpting patients, because many patients come back for more areas. They've been so happy with their results, and they'll have the opportunity to have $400 off of their next package treatment. In addition, attendees today will have the opportunity to enjoy 20% off of your soft wave skin tightening procedure. It doesn't have to be in the area that you're treating for Coolsculpting if you want to do that. If you don't want Coolsculpting and you just want a soft skin tightening soft wave consult, we can certainly do that. Tomorrow, we'll be holding our drawings for our winners. We'll contact you guys tomorrow. And again, we're going to be giving away a $3,200 Coolsculpting package. We'll be giving away the firm and tone treatment, which we also have here in the office for our Coolsculpting and liposuction patients. And we're going to be giving away some Skin Medica products as well. So join us tomorrow. We'll try to announce that on social media, and then we will contact you. Let us know if you're interested in any of these treatments or anything else that we did not discuss we're always available to help you. And then remember to text ELITE to the text that you'll receive after this webinar, and then we will contact you with any further questions and try to set you up for a consultation during Cool Month, which starts tomorrow. We're so excited to have you here. Have a great evening, and we look forward to hearing back from you guys. Good night.
Good night.
Night.
All right, thank you.